Thank you, Dr. Ahmad, who elaborated on the clinical data and how good this medicine sounds. Do we believe it? Unless we experience the medicine, we can only then believe it, although the data sounds impressive. I have the privilege in trying this, one of the earliest in UAE, and I'm happy to share my experience with this medicine. Case number one, 47-year-old lady who came with her husband. Her husband also suffers from rheumatic disease. She had 2 years history of rheumatoid arthritis, being treated in some other hospital nearby. She had courses, steroids, methotrexate, Plaquenil, and a good initial response to start with, and then the disease started to flare. She has been stable for 2 years, but then gradual deterioration, increased pain, increased stiffness, and swelling of the wrist, and MCPs. It's a story we all face. She was offered biologic therapy, but she declined it, and I'll explain later why she declined it. She's seeking second opinion, and she came to me, and she tells me they offered biologics, and she is not keen on them, and she is still worsening by the day, and coming this time to see if she might accept biologics. That made it easier for me to discuss it. When I looked at her, she has a severe disease, aggressive disease, with so many joints swollen, tender, high ACR, CRP, RF, DAS score 6.6. And if I would apply PROs, rapid 3 could be over the roof. Technically, she was on combination with Plaquenil and methotrexate, so that also make it most legitimate to go to biologic time. And we discussed the options, and it's good that we have an option now taken orally. Because first, I gave her another course of steroid, we did biologics, everything negative, and with the steroids, there was one slide missing, I think. Yeah, with the steroid, she had some response, which is a very good. Sorry, we are missing slide here. She started baricitinib, as we started here, and she came on the first visit 2 months ago, and she is doing brilliantly. I never thought she is going to do that. That's one of the first cases there. And when I looked at her, she has tender joint, swollen joint, all improving. ESR, you look at CRP 0.74, DAS 2.8. This is what we call a sometime Boolean remission. She's almost there. And from that very aggressive presentation to a Boolean remission, that's quite fantastic. And her husband apparently suffered from AS, and he takes Humira for 3 years, but the effect is fading away, and that's why she is not keen on injections that might fade away with time, and he was deteriorating. Decided to register my clinic. Why her husband wanted to come into my clinic? He is asking if he can have Olumiant as well, which I have no way to prescribe it to him, no indication. However, but what the husband told me is another PRO. I did not expand on my talk because one of the PROs you take is family. And this is a PRO provision to this lady. It means she is doing really fantastic. It's not only could be misled by the number of joints or whatever, she is truly well. So lessons from there is she declined injection because of husband's experience. JAK provided us another option, which is orally therapy, impressive response, and it was very, very quick. And the husband did say within a week she is much better. So that's one of the, let me say, messages we get from this. The other lady is a British lady who came to me. She was prescribed Cimzia. She had Enbrel before, but Cimzia for RA, and she was stable. She moved on to UAE. She takes a combination with methotrexate, hydroxychloroquine. First time she came to me with a synovitis of the left wrist. I say it's a one joint. Let's deal with it with course of steroid, local injection. Everything went well for a while. And then I changed her hydroxychloroquine to sulfasalazine. Kept doing that for another year or two. Everything is okay. And then came back again with the left wrist swelling. And CRP was 14 this time. Ultrasound showed grade 3 synovitis on both wrists, despite having no pain on the right one. DAS is scoring high. When we examine all joints, we discover a lot of tender joints here and there. And she also started, she tells me now she stopped Cimzia. And the reason for that, because she started to fed up with injections and having injection reaction. So if you have conventional DMARDs and biologic DMARDs, if you are stable, I am in a school that we stop conventional DMARDs because the biologic has made the better difference. But this lady went to some advice. They say, if you are okay, stop the biologic DMARDs and stay on conventional. And that's the result of it. And we gave her some injections and steroid, and then we decided to switch. And because she fed up with injections and reactions, we again went for Olamia. And again, within very short time, she had a CRP drop to 7 and no swelling whatsoever. And she is back to her sport activities and everything, and is as if nothing happened. So it's quite an impressive story as well, but this is a biologic failure case. And that's the report. We asked for the insurance for approval, and that's her actual report, as you see. The case 3 is, it was a challenging at some point for me because she's very young, and inflammatory arthritis, more of a spindle-shaped PIP joint swelling, morning stiffness. She has CCP positive, but always ESR CRP negative. And that always makes me doubt of diagnosis at some point. But the presentation classical of rheumatoid, and as a bone scan did show uptake on the PIPs universally. And we started steroid, methotrexate, did well for a while. And ultrasound did show some synovial thickening, no clear Doppler, that's after steroid and methotrexate. She went to other hospital and started biologics, Humira, based on some flare-up. So she came back to me when she had a flare-up, Humira, with a good initial response, but then a flare-up again. And the challenges started because this patient every time responds 2-3 months and then it flares again. So I switched her to Actemra. As she's younger age, I thought she's nearer to juvenile. Let's try Actemra as well. And how many minutes? Yeah, I have time. This is the case 3 anyway. All right. And again, with Actemra, had a great response, but again, the same flare-up and swelling after 2-3 months. And till October 2018, flare-up on the MCPs, PIPs, very high DAS, and then switched to Olamia. Again, within a month, she has responded, improved by 70%, no pain, no swelling. CDI, in her case, down to 5. DAS score was 2.9, and she is a very happy young lady now. And that's the report to apply for insurance. And these are just from local experience. I have more cases actually, and all as impressive as these 3 cases. But these are give you a naive case, DMARDs, inadequate response, biologic inadequate response, and showing how quick the pain and how PROs could improve. And thank you very much.